opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Good morning and welcome to Ask Dr. Doreen. I'm Shannon Penrod and I'm here with the fabulous, the wonderful, the magnificent Dr. Granpeesheh. Good morning.
How are you?
Good, how are you?
I'm good, thank you.
So thrilled to be here with you. We haven't been together in the studio for a couple of weeks. So
yes, and I'm not going to be here next week, so I thought I definitely have to come in.
All right. Well, that's so sad that you will miss next week because it's somebody's birthday next week, a week from today. I know. So we're very excited about that. But thrilled that you're here today because we got a lot of things that we're going to talk about. For those of you who don't know, Dr. Granpeesheh, I'm so glad that you're here for Ask Dr. Doreen to talk with her because she's a true expert in the field of autism. We've been doing a version of this show. We're in the 14th year now, which is absolutely amazing. It is its own podcast right now. We encourage you to subscribe to it as its own podcast to get all the new information and be able to ask questions and so on and so forth. We're live right now on Facebook, YouTube, and Twitter, and you can be writing in right now saying hello. And my goodness, I just looked down and a lot of people are already writing in. That's great. We're saying hi to Andrea, Esther, Susie, wonderful. And you guys have written in questions. I love that. Our topic today, our overreaching topic that we're going to start with, but then we'll get to anything that you want to talk about. The topic today is when you feel like you might be missing something that could lead to progress, which I think all of us who identify as being, I call myself a pony, parent of a neurodiverse individual, the fear constantly is that there's something that we're missing. So we're going to talk about what those things might be with this wonderful expert who's been working in this field for 40 years. Yes, working in the field for 40. You don't even look like you could be that old. I say that every week, but it's true. So I hope that you will write in and ask the question that you want to ask. Some of the guidelines are, please be as specific as you possibly can be. Tell us what the closest major city is so that we have an idea of what resources you might have available. We love to know the age of the individual and any clues that you can give us about where they are in terms of what they need and function.
And for those of you who are actually live with us, it's awesome because we can ask those questions.
Yes, we can talk back to you, and that's a wonderful thing. But we encourage you guys, the show is live right now, as I said, on Facebook, YouTube, Twitter. It will then later on be available on those places, but additionally, it'll be available as a podcast to download. That's our larger audience, is the podcast audience that takes and listens. So you guys don't get to see how fabulous she looks. Sometimes you should go over to YouTube and see, check out, what she's wearing. I always love your shoes. I'm never going to be able to live up to your shoes. But anyway.
Like Shannon, you're being so nice to me. I have to say during this show in particular, I'm going to be moving around a lot because our viewers don't know, but I had knee surgery, which is why I wasn't here last week. But I can't sit in one place, and like you were talking about my shoes, I only can wear flats now.
They're so cute. They're fabulous.
It's so hard to do anything right now.
I'm always moving around because of my back problems. Do whatever you feel that you must.
Thank you.
You have my permission. I'm a squirm worm constantly, so it's all good. And for those of you listening in podcast, you can't see it anyway.
That's true.
But the content is king, right?
Yes,
what we're talking about is always so important. And over the years, so many people have written in and said how much hope you've given them.
I'm so glad.
How much
that's
direction.
Good. Thank God. Yeah, that's wonderful.
And that's literally what they say is thank God for you, which I'm one of those people too.
Thank you so much.
Thank you.
Thank you.
So we're going to get started here talking about a question that came in. I'm going to go to this one first, and we're all going to hug this person, and we're going to hold on through this. The person says, my child started ABA at age 4. We did 15 hours of ABA for 2 years and then continued to do 10 hours a week for the last 2 years. I am frustrated that we have not made more progress. He can speak but does so only to get things that are important to him, and I worry that we will never get to true conversation. What did I miss? I thought I did the thing that I was supposed to do. He is potty trained but not poop trained, and he has regular diarrhea. So we have to start by hugging this person, and we all have to acknowledge that you know, we didn't all get the same information on the same day, right?
Right.
And that you can't beat yourself up about what you didn't know then, but there's some things that could really help you now. And I fear that this parent's going to have some grief when we tell them that there are things that they didn't get told, and that's unfair.
Yeah, but that's okay.
But
that's
let's be
okay
honest
because,
about it.
Yeah, but that's okay. And so the way that I look at it with our kids is, as long as your child is progressing and visibly you can see that they're learning new things and doing well, then you as a parent have done your job. You've done what you can and they're doing all the things they're supposed to do. At any given time, whether it's a child who's learning stuff really fast or a child who's learning slower, at any given time, if you feel as a parent that something else comes up that needs to be dealt with, you deal with it and you just keep going. It's not because everybody's so different. I don't look at it as it's a program that begins here and ends there. It's a way of life in some ways, right? So you know, you've done a lot of stuff. That's great. I'm sure that your child has learned a lot in those years of having ABA, and maybe now you need to do some additional stuff that'll help. So one thing that is so important, and I'm doing everything I can, honestly, now about this, is that people need to realize that our kids sometimes have other medical issues, underlying medical issues that make it hard for them to function and or learn and or thrive in life. So if, you know, diarrhea is one of those things, right? Gastrointestinal issues are very common in kids on the spectrum. And because we are so focused on how do I teach him to talk, how do I teach him not to have challenging behaviors, how do I deal with the symptoms of autism, autism overshadows these other underlying medical issues, which are so important to also deal with. Because if you think about it, if you had diarrhea, what would be the normal expectations that you would place on yourself on a daily schedule, right? Would you go to work? Would you schedule a full day of activities that require learning? You know, it's very hard, and not just is it difficult for the child, but if they have diarrhea, they're not getting all the nutrition that they need for their brain to actually be awake, functioning, paying attention, and all that sort of stuff. So it is really time for you to pay attention to the medical issues right now, and that is extremely important for any parent. I always say, and now we've started to coin a new term here now that we're back at CARD, because I'm bringing in medical partnerships, and we're calling it medically enhanced ABA, because I promise you, if you focus on making sure the child is healthy and sleeping well and eating nutritious, good foods that are meant for that particular child, they will be at their peak of learning. They will be in their best shape, therefore they will be learning faster and better through your ABA, speech, and other services. So I think you should focus on that first. And then secondly, you can, as a parent, I mean, any parent, if you're having questions about how's my child actually doing in the realm of things, and I get that question very often. A lot of parents will say, okay, so he's learning, but is he learning enough? How much more is there left to do? All that sort of stuff. Then what you need is an assessment by someone else, right? So BCBAs, the folks who, board certified behavior analysts, the folks who do ABA and supervise ABA, are not trained to do standardized assessments. Those are things that are done by a psychologist or a developmental psychologist or psychiatrist. And a lot of times those are things that are done at university settings, clinics. So I would recommend for every parent to find like an autism specialist or even just a child specialist in assessments, so that you can go in and annually or every 2 years get a full battery of assessments. It's kind of like a mental health check, right? So we do, you do a physical checkup, right? When you have a doctor, you go and do a physical checkup every year. Do one that has to do with the autism. So these would include things like an assessment of language, an assessment of social skills, an assessment of adaptive skills, and anything else that might be an issue. Like, some parents will come and say, I'm very concerned about his memory. I'm very concerned about how he views things. So, there are neuropsych tests that would be helpful. It depends on what your issues are and what you want to see. Yeah. But those assessments done by someone else are pretty helpful in seeing how your child is progressing. So that's what I would start.
And that would help to determine how many hours. Because that's the thing that jumped out at me in this question.
Yeah.
And I don't want this parent to feel bad, but I also don't want other parents watching who have 3-year-olds. One of the things that we're talking more and more about on the show, we've always talked about intensity.
Right.
We've always talked about intensity and how important intensity is. But
right.
more and more we've been talking about the fact that if you want to learn a language,
you do a lot of work on it.
You do a lot of hours.
Yes.
And you either do that, well, it's not either, it's both. You're doing that with help, with professional help, and you're doing it at home.
Yeah.
So if you're not getting to the place where you want to get, I hope that parents are asking for more professional help, which means asking for more hours.
Yeah.
That, what you describe is that they started when they were 4 and that you had 15 hours.
For 2 years.
For 2 years.
So that means 6, and then after that they had, I think,
10 hours.
10 hours for I don't know how much longer. So I'm trying to gauge how old the child is.
So it would seem to me that it's 2 and 2, so the child is now 8, right?
8, right. So, and then I guess I have another word of advice for kids who are like past 6.
Right.
I think it becomes important at some point, when your child is below the age of, let's say, 5 or 6, you have the luxury of time. You have all the time they have, and you don't really have to worry about things like academics yet. But once your child turns 5, maybe 6, there's going to be pressure on you to place them in school. And a lot of parents think, oh, school is a good thing because that's where my child's going to get to learn a variety of things and also socialize with other kids. But the truth is, for our children on the spectrum, a lot of times they're not really reaping the benefits of a social environment, and they're not really good at learning in a group setting. So school doesn't necessarily become the best setting for them. Some kids it is, and some kids thrive. But for many of our kids, one-to-one interaction is a lot more fruitful because the child is able to learn a lot faster, and everything, the instruction is all focused on how your particular child learns. So, but the unfortunate truth is that by 6, it becomes really hard, and you have to then add some form of academic thing into your child's life, right? Because that's just the law.
Right.
So with that in mind, knowing that your child, let's say, is 8 and you have some pressure on you at this point to also have academic, but you're very concerned about various other things like toilet training and all those types of things, I would really reduce the things that are not important to me and increase the things that are important. And that becomes a process of just sitting down with the whole family and actually saying, what is important to us, right? What are the things that we need? Like, for instance, toilet training. If he was toilet trained, it would change his life and our lives.
Yes.
And so let's make sure that, let's prioritize that above everything else. It doesn't matter if he's going to be learning math. Let's make sure he's toilet trained. Secondly, let's look at his comprehension or language expression. Thirdly, then we can look at, like, are there challenging behaviors? So prioritize it and start being very selective, and then focus on those things that are the most important, and in terms of allowing your child to be able to join society, right? Those types of behaviors, like not being toilet trained, maybe in some cases challenging behaviors, those types of things tend to isolate our kids because, let's face it, you can't take him out, other people don't want to be around it, that kind of stuff happens. Yeah. So work on one thing at a time and don't try to work on everything. And because otherwise we tend to get pretty overwhelmed with the amount of stuff we need to, incorporate into our child's program.
There we go. Esther has written in and said, hi, I'm trying to get my 4.5-year-old son with ASD ready for kindergarten next year. What are your thoughts on getting an educational therapist for him, and do you recommend anyone in Los Angeles? She says, just a note, he knows his ABCs and he can count to at least 30, knows shapes, colors, etc. And she also says, thank you so much for all you do. I love you guys so much. We love you back.
Thank you very much, Esther. So I don't know... I don't know what the goal is. If you're, he's just starting and he seems to have quite a bit of academic knowledge already at 4.5. So are you worried that he's going to fall behind? In which case, sure, an academic tutor might be helpful. Or are you, tell me what your worry is. Why would you want to do that? Because it sounds like he's already learning anyway.
Yeah.
My preference would be if he's good at learning and he's already learned all this academic stuff and then he goes to kindergarten and he'll continue to learn when he's in kindergarten. The thing with going into kindergarten is that you're starting to hit 30-hour week programs, right? Kindergarten is long, which reduces your time teaching anything else. So in other words, do the academic during the academic time, which is already very long, and teach other stuff outside of the kindergarten program. So if you, instead of getting an educational therapist, I would get maybe a sports person, teach him some physical activities, teach him leisure activities, teach him crafts, arts, teach him how to socialize, teach him how to expand his language, teach him safety. There's so much other stuff that comes outside of the academic.
And it seems like he's doing really well.
Yeah, that's
awesome. But if the time
awesome.
comes that somebody does need an educational, tutor person, I have the best LA person.
Oh, great,
I
great.
really do. She's amazing. I've introduced her to you. She's rocking. I took Jem to her, and I listened in through a partition. She's amazing.
And see, that's also...
And she's good with little ones,
And that's
too.
also very important, because once your child enters school, just first of all, just observe and see how he or she does, because some kids are fantastic when they enter school, and others really struggle, and that's when you want to have a tutor, because you want to have the school experience needs to be positive.
Well, and sometimes you have an idiot stick for a teacher, which...
Yes, true. Also,
and I love teachers. I was a teacher.
Also true.
But we had a really bad teacher who was so bad and just didn't teach him, and we knew we were behind. And
yes, that definitely
and
does
we got
happen
compensatory
too.
Education from the school because
did you?
Because the teacher blew it
badly,
and admitted it in a meeting where I had a tape recorder running. It's good to have a tape recorder. And they paid for him to go to this person who is absolutely the best in LA. So if you need an LA person, I have them. Okay. Andrea wants to know, I know this has been asked in so many different ways, but I'm struggling right now, so I kind of want to hear it again. It's okay, we get that. How long does a verbal child that is able to tact complete interverbals, answer simple rote questions, need ABA before they become conversational? It's a great question.
Yeah, it is. And again, I think, so for the audience, tacting is labeling, manding is requesting, completing interverbals is talking about things that are not necessarily present in front of you, and simple rote questions he's answering already. I think your team, Andrea, and I don't remember now how many hours you have ABA going on, but this is the time where they need to just focus on conversation, do tons of play dates and activities where conversation is the focus. Because honestly, I have children who have not even a lot of interverbals, and they're just so adamant about conversing with you that they will converse with faulty language. You know what
gibberish.
I mean? And so conversation is something that needs to be useful to the child, I guess. The child needs to get something out of it. And your team should be really focused on conversation. And it's not just about teaching tacting and manding and stuff. Conversation has a lot more behind this, right? It has to do with identifying a topic that's of interest to someone else. A lot of times with a young group of kids, what we do is, and by the way, when you do conversation, you want to go one-on-one with one other child first and then with multiple other children, because if you put your child in a scenario with multiple other children, those other children tend to talk to each other, and then your child gets left out. So one-to-one first, and then you're focusing on, okay, we have a game. We are going to talk using this game. That's a very good technique. And as, you know, or this object, or some activity that involves verbal behavior. And then from there, and you take turns. So there's taking turns, there's selecting the subject, there's being able to answer questions that the other child asked. There's, then recognizing things like being able to read the other child's facial expressions, so that if the child's getting bored, we have the ability to change the subject. It's actually listening to the other child and commenting, or listening and asking appropriate conversations. All of that goes into conversation, and if your team can teach each of those types of things, then you can bring it together. It's not enough to have just vocabulary. You need to have all these other kind of soft skills, we call them, that come together for conversation. So just tell them all you want to focus on is spontaneous conversation, and that's what they should be doing.
I think one of the things that I'm noticing lately is that because people, I don't know whether it's a byproduct of having centers now, and there's so much DTT that's what gets filmed, that's online. When people look up ABA, they see
I wish. I'm having the exact opposite experience right now, where I'm having a hard time getting people to do DTT.
Well, yeah, but I think what's important for parents is to understand the whole spectrum of it, right?
True.
That if you're going to start, and the thing that I always compare it to, I compare it to skiing or dancing. That if you're going to learn salsa dancing, right, you don't just, if we're going to learn salsa, you can just put music on and dance, right? But if you really want to learn how to salsa, you don't put music on it first, and you put the little paper feet on the floor, right? Excuse me, and that's like the DTT. We're going to separate it, take it to the side, not have as many things going on, and learn, okay, it's 1, 2, 3, 4. Yeah. But if all you ever do is 1, 2, 3, 4, then you're not really salsa dancing, right?
Right.
So there's a point where you're doing the 1, 2, 3, 4, 1, 2, 3, 4. Now we add some sensory, we add the music to it. We try to make it our own and make it fun.
You add your hand gestures,
right?
And
You add all these things into it, but then eventually you haven't done salsa dance if you haven't at some point gradually taken the little shoes away. You can come back to them, but you put on the music and you dance with a partner and try to have fun with it. But then you're still doing it in the studio. Right. And eventually you want to be able to do it at the club.
Yes.
And that it's the same thing when we're teaching any skill with a child. First, we're going to take it to the table. We're going to practice it by itself. Right. We're going to add in more elements. Then we're going to take it away from the table with another person. Then with another child. We're going to do that. Then we need to take it to the 7-Eleven.
Yeah.
Right? And I see that people aren't pushing for that.
Right.
To have it go through and I think parents have a misunderstanding that, I dropped my child off, you're going to do it with them, and I don't need to know how to take it to the 7-Eleven.
Right.
And you can, by the way, for ABA, you can ask for your BT to go to the 7-Eleven with you. Yes. Right? That's a whole planning thing. But there is this progression. So for language, we're going to take it to the side, work on it, all those things that you said that he can now do, right? And now you're trying to put it into circumstances with another child, with another adult, whatever. But at a certain point every day, you need to be putting it in the real world.
Absolutely. And I think just to kind of sum up what you're saying, with ABA, you start with some rote instruction, which is just memory. It's like how we all learn, by the way. When we go to, when you start going to school, think about it, the alphabet is completely rote.
Right.
Numbers, it's all rote. But then you put it to use. And so with ABA, what you do is you start with discrete trial, and then you go into a natural environment type setting. But what Shannon is talking about, which is very, very important, is generalization. You have to take the information that you learned, whether it was a discrete trial or a natural environment or however you learned it, and generalize it, right? So that means it has to become something that you do in different environments with different people at different times, different settings, different activities, that kind of stuff, and then it becomes part of your real life.
Yeah.
And unless that happens, like tacting is a good example of, let's say with tacting or even interverbals, right? So with tacting, you're just like, tree, there's a whatever, bus, car, things, you're labeling things that you see, right? Or interverbals, you might be actually responding and talking about things that are not visually present. The sky is blue, mom wore this, the teacher's name is that, all those types of things, but they're all kind of, they're prompted by either a visual stimulus or an auditory stimulus. And what you're trying to do in conversation is the prompt for the next sentence actually is in the environment. And so, which means the person you're in front of, the location, the activity, the setting, whatever it is, that's what prompts the next statement. And it seems to me that that's an area that your team needs to work on right now.
And she says he's getting 40 hours, which is amazing.
Oh, that's amazing.
Absolutely amazing. But I love, the play date thing. We were constantly trying to create, we were taught how to constantly create situations in which we always thought of it as passing the ball back and forth. That I throw the ball to you, and how many times can you throw it back to me, and we throw it back and forth.
Absolutely.
So in the beginning, Jem, I would throw the ball once, and he would catch it and not throw it back. The BT would be there and say, what can you ask Mom? Mom just said this, what can you ask her? They would prompt it, right? But then eventually he could do it without prompting, so the ball would go back and forth once. And we kept trying to get it to the point where it would be 3 volleys back and forth, and then 5, and then 7. And I'll tell you, something amazing happens. After that, it's just there.
Yeah, exactly.
And you're able to have and it just magically happens.
It happens because you're also telling the child, ask something else. Because in the beginning, the child will be asking the things they've memorized, obviously.
Yes.
But there's a team there that's prompting and saying, is there something else you can ask? Is there something else you can say?
Yes.
And that's when the child starts to generate their own responses, and that's a very big part of conversation.
And I will say this too, they weren't just prompting him, they were prompting me too. They're like, ask him this.
Sure.
Or what else can you ask him? Because sometimes we're so in our heads about why we're not able to have conversation that we forget to volley.
That's right.
But we always thought of it as passing the ball back and forth. You're doing a great job. You'll get there. Helen's, we're saying hello to you. Hola to Alicia, who says hola to Shannon, and hola to Dr. Doreen. Anna says, good morning. My son has ABT, ABA, PT, OT, speech outside of school, and one-on-one services at school with a one-on-one aide. I have seen huge progress in the last year. I remember when he was diagnosed, he also got the intellectual disability diagnosis. Mm-hmm. I see how smart he is. Like programming and reprogramming the iPad and the TV.
Yep.
Don't we love our kids? Mm-hmm. We just hand them the remote, they can do it. He can spell on the Roku what cartoon he wants. My concern was it too early to get diagnosed with ID since we had minimal services when it happened and COVID hit later that month. Do ID diagnosis ever change?
That's a great question.
Isn't it?
Yeah, so diagnosis of intellectual disability is based on 2 factors. So at some point when they gave you this diagnosis, they must have tested him on 2 tests, 2 types of tests. One is a intelligence test, an IQ test, and depending on his age, this would have been a Stanford-Binet or a Wechsler, which is either called the WIPSI or the WISC, you might remember. And then there's also a test, the Vineland is usually given as well, because you need to have a secondary, which is an adaptive measure. So the thing about IQ is that the way we measure IQ is it is your mental age, which means all the things that you know, divided by your chronological age times 100. So if I am 60 and my mental age is that of a 60-year-old, so I'm functioning normally, then it's 60 divided by 60, which is 1, times 100. So average IQ is 100. Okay, so all typically developing people, the average is 100 is normal IQ. Now there are some people where what they know is slightly less than other people of their age. So their IQ might be 90 instead of 100, or 85 even instead of 100. And then there are people who know a lot more in comparison to their age, and their IQ could be over 100, right? So this is kind of a normal curve. The majority of us have an average IQ of 100, and then the vast majority, 98% of people, will be between 85 and 115. And that's called a standard deviation. That means the vast majority of people in the world will be between those two numbers, their IQ, right? Standard deviation of IQ is 15, below or above. So what does that actually mean? That means that, yes, the more you learn, the higher your IQ can be. People don't realize that IQ is malleable. There's lots of articles on this. So if you have a child who is learning a massive amount, as it sounds like your child is, their IQ is constantly changing because they're aging, but they're learning faster than they're aging. The opposite is true as well. If you're learning slower than you're aging, then your IQ is going to fall behind, right? So that is the whole purpose of wanting to do intensive work with a child when they're young. Yep. Because up to the age of 7, our brains are very, very flexible and fluid, and we learn almost everything that we're exposed to. The brain learns very quickly up to age 7. That's why when kids are exposed to languages before age 7, they just pick them up. Yep. So that's the goal, is to take that period of time where there's like huge brain plasticity and just bombard the child with information. That's why we say 40 or all waking hours, right? Because that's when the child can soak all this in, and they're learning faster than they're aging. So in any given 1 year of their lives, we're teaching 2 years worth, right? Yes. So that's how we get a child whose IQ is lower in the beginning, and they're called intellectual disability. They have the diagnosis. Anything below 85 would be classified intellectual disability, right? 85 to 115 is still within the norm. And 85 or 84 would be classified as borderline. So basically, yes, if you get your child tested again now, because he's learned so much, that IQ score will probably have increased. And the more and I do recommend for parents whose kids are rapidly learning, not only is it important, I think, to you as a parent, it's rewarding to see that your child is learning, but it tells you you're doing the right thing, your child's on target and they're learning. And IQ tests, when you actually look at the subtests, there's lots that goes into an IQ test, it's rather lengthy. They give you a lot of information about how your child learns. Like from an IQ test, if you're with a good psychologist, they can tell you if your child has a visual learner, if they're an auditory learner, if they have really strong textual memory, if working memory, like, these are the things they're really good at, like pattern analysis. These are the things they're not so good at, like listening comprehension. And you need to work on the things that they're not so good at, because those other things, they're super strong. So overall, I think getting an IQ test can be a good experience. It can also be a bad experience for parents, because then you start to worry a lot, right? And so I don't really think that it's valid. And by the way, this is the other thing I want to say about IQ tests, is that they're not really valid for our kids, because IQ tests, the majority of them are verbal. So they're asking you verbally to do something, and sometimes they are requiring you to respond verbally. And so if your child has a language deficit, your child's naturally going to score low, because they're not either understanding what's being asked, or they're not able to express what's being asked. That doesn't mean their brain is not able to do that. So often when a parent gets a low IQ for a child where they're like, this is a smart kid, he's problem solving and programming the TV and stuff, I will recommend not just to get a verbal IQ again, or like a standard IQ, but I will recommend to have them use a non-verbal test, like a test that would be designed for hearing impaired kids, right? So the lighter R is always, or lighter 3, I think now, is a really good test. There's other tests like the Merrill-Palmer, et cetera, that are very good for hearing impaired kids. So that means everything is done visually. Instructions are given through modeling. The response is expected to be nonverbal. And so there we're getting a better understanding of the child's true intelligence.
But I want to also say to this, because you touched on this about, like, it could be harmful in terms of, expectations
Emotional,
and things like that.
yeah.
But I also want to say they did a study, and I don't remember whether it was 80s or 90s, but they did a study where they tested a bunch of kids in a classroom, found what their IQs were, and they separated the kids into 2 groups. One where they had higher IQ and felt that they were gifted, and one where the kids were not.
Yes.
They did not test that way. And I don't know who allowed this test because it seems unethical to me, but the next year, what they did was they took all the paperwork and they flipped it. And they gave the paperwork to the teachers, and for the kids who were gifted, they said, these kids have lower IQ. And for the kids who had the lower IQ, they said, these kids are gifted. And then they let them teach them for a year, and then they retested them, and the test scores were flipped, which tells me, like, it sends an impression, and people teach or don't teach. And when you're teaching to them as if you think they're gifted, then suddenly they learn more.
So that's actually really interesting, Shannon, and that's very likely the reason that schools are not allowed to do IQ tests. Because I think it is true that you do tend, it can be stigmatizing. But you can't get, even at your triennial, you cannot get an IQ test from a school. You need to have a licensed psychologist or a developmental psychiatrist or neurologist or a testing center or somebody like that do it.
But if it were me, I never allowed that information to be disclosed to the school.
Yeah.
I would like sign the paper and say they can see everything but that, because, or you just flat out lie to them and tell the school, yeah, he tested gifted and positive. And then... I can't believe I just said that. Well, but, I mean...
Yeah, the truth is you do not want anyone to, I guess, categorize your child in one way or another. Every child is different, and every child should be given the best instruction that will lead to their highest outcome.
There we go. Rodney says hello, or saying hello back. Jaitha wants to know, hello, doctor, can you please comment on the usage of magnesium supplement? Is it safe? And they would also like it if you could refer a very good functional medicine doctor in the Texas area around Dallas.
Yeah, so yes, so there's different types of magnesium, and magnesium can be used for a multitude of things. It is calming. It is also something that will help stimulate the gut. So it's often used for kids who have gastrointestinal inflammation and can't go to the bathroom regularly. But I can't think of one off the top of my head in the Dallas area, but I do recommend that you look on MedMaps, which is an organization that has a lot of doctors who are trained for functional medicine. So look on that website, medmaps.org. Do you know?
.org. Medmaps.org.
And you'll find someone,
Absolutely. And now with telemedicine, it doesn't have to actually be somebody in your area.
This is true. It could be anywhere.
And you'll find all kinds of doctors. I would tell you to look for the kind of doctor that you are looking for, because MedMaps doctors do all kinds of things. There's one that's a sports medicine specialist, right?
Yes.
There are some that are gastro. There's some that are neurologists. And everything under the sun. So I would say find the one that you want, not based on where they live, and see if they do telemed.
That's a really good point. And I recommend having a conversation with them on the phone, because you want to make sure you kind of get along and you think of things the same way. Yeah.
I always recommend to talk to the staff too, because sometimes you want to be able to ask a question and maybe you don't need to talk to the doctor and pay $140 a minute.
No, that's absolutely
I'm exaggerating, but okay, and then Esther wrote back and said, because you asked what does she want out of the getting him ready for kindergarten, she said, I want to make him extra prepared so that he feels comfortable. I'm hoping that they can help with him paying attention and following directions. He's already has a soccer and an art teacher, which is great. They do want to know who I recommend as an educational coach.
Yeah.
Andrea Watkins, her program is I Learn the number 2 learn. So it's ilearn2learnacademy.com. But I want to make the case that if what you're wanting is for him to pay attention and follow directions, the thing that I would say the best people to do that would be your ABA team.
It would, and it depends. I don't know your child well enough. I just want you to, Esther, just make sure that other areas are strong. Because once you're in school, everything becomes academic, right? Now your focus is just going to be academics. So they might teach him, part of paying attention, obviously, is learning to pay attention when you're sitting further away from the instructor in a group of children. All these types of things are things he will learn in school, and it will improve his attention in that sense. But let's make sure that other parts of language development and social development, particularly executive functions, cognitive issues like just problem solving, those types of things are good too, because you would need to focus on those before we get into first grade. So
Daniel has written in, and I'm going to flip the order in which you said these, Daniel, because he says, when my eldest son transferred schools, they had little to no understanding of spectrum children. I gave them a 10-minute video presentation to explain it to them, but they still had issues with school. He says social interaction is needed, but there's many instances of schools not being the best place for special needs kids due to people who do just enough to get certified but lack understanding of ASD.
I fully agree with that, Daniel,
Yes, me
and
too.
that is just a sad fact, but you're absolutely right. And
He goes on to say one more thing. Forgive me
Sure.
for interrupting. I told the teachers at my eldest school when he was still in elementary to tailor his curriculum to one of his particular interests he's fixated on. It can their interest and result
it can keep them interested
and result in
learning
learning more. Yes, got to be careful with stimuli. Fight or flight instinct can be triggered very quickly and induce a meltdown depending on sensory and environmental trigger. I think that was referring to something that somebody else said.
Yeah.
But he goes on to say visual demonstrations are usually the best. They can usually see what's being asked of them and have a visual cue of what needs to be done instead of written instruction that can be a jumble. But
Right, and Daniel, that is true of some children and might be true of your child. And then there are other children where they absolutely cannot receive visual instruction because they have a lot of issues with visual perception. I've had multiple children where a stimulus is, they just can't see the stimuli. They are not able to focus. They're not able to ground discriminate when a visual is in front of them. Children are different. All kids are very different. And you have to, I think it's a game of making sure the child, you're using their input, sensory input strengths, but also helping them develop the ones that are not as strong. But at the same time, I think it just depends on the child's, what they need to learn, what age they are, how much time we have, all of those types of things.
I promised Marina I would get to this one. I know
course.
we've got a lot of questions, but this one had already come in. When and how to request a change of therapist, RBT, and BCBA. I don't believe my son is progressing with his current goals, which is independence at school, and instead has regressed in other areas like social greetings and toothbrushing. I believe his previous therapists were more active and I saw more progress. I want to follow the right process and for the right reasons, because if it doesn't work, I'm afraid of being retaliated against for my son or my insurance hours covered. It's a great question.
It is a good question. I think you should, I don't know where your child is, but I would definitely have a conversation with the BCBA and start there and say, I feel like these are areas he's regressed. These are things that we planned on reaching these goals and they're not happening. Just be very honest and tell them all of this. And say, I'm really concerned that things are not improving and either we need to change staff or I'm going to start looking for other providers. Be honest about it. I think sometimes I cannot stress enough how important the relationship is that you develop with your BCBA, because They're supposed to listen to you, understand, be supportive, do the things that you expect for your child, be willing to change things, be willing to modify, be willing, I mean, they're supposed to be really your friend in this process, right? Your guide. And so I really highly recommend that you start there. Now, at CARD, we have clinical directors who are above all the BCBAs. In fact, we have all the group clinical managers, but above that is clinical directors. So at CARD, if there's ever a situation like this, we highly recommend that you talk to one of the clinical directors, and then they jump in, and that's their job. That's all they do. They don't have their own patients. There's a bunch of them, and what they do is they drop in on our kids and our supervisors, because the vast majority of BCBAs now in the world are pretty young. I'll be honest. They're straight out of school, like people graduated a year ago. And not to say anything bad about anyone who graduated a year ago, but you just don't have the experience when you graduate a year ago.
Well, you believe in the power of mentorship, which is a great thing.
Absolutely. And I also believe very strongly in the power of experience. There's just time.
Yes.
I mean, I look at myself when I was 27 and got my doctorate degree, and what I knew then and what I know now. And I'm thinking it's a whole different thing. Like the more children you work with, the more families you've learned from, you learn more, you have more experience. That's why all my clinical directors are 20 plus year seniors. Yes. And I think that's very important, is for you to be able to go to someone in the organization and say, I'm just worried, like you guys need to help me. And don't worry about retaliation. If they retaliate, they're not the right place for you.
Exactly.
So.
Exactly, I couldn't have said that better. Yes, and if you see that, move. I mean, and that's disheartening, but that is the best thing to do. Okay, Sarah has written in it as a follow-up to Andrea's question, and then she has a question of her own. If a child has started interverbals, is it a good indicator to include in school? And I want to know, do you mean for the child to be included in school or to include the lesson of interverbals in there? But her question was, by the way, my ABA therapists go to school with the twins. I include those 4 hours a day as ABA therapy in a social setting and include it as part of my 40-hour week calculation. Am I inflating my ABA hours?
That's a great question. Not if you have the opportunity for one-on-one. So there is when I look at the ideal program for a child, it sounds like you're in that. You are doing the right thing. Because when I look at an individual program, I will be working one-on-one with the child at home when they're, let's say, 3. And by the time they're 4, 4.5, if I have to introduce school, I'll be introducing school at a minimum amount. So maybe, I don't know, 2 hours a day, 3 hours a day maximum, depending on the child's level. And if I have an ABA therapist, the BT, with the child in school, then and the child is actually like learning to generalize, learning to follow instructions from the teacher, learning to be more independent on their own work, learning to interact with other children, learning to share, learning all the things that are necessary in school, then I can include that. I would include that, because my ABA therapist is standing right behind the child, prompting them, and then gradually teaching, shaping their behavior, and then fading themselves back. That's a big part of taking a home-based program or a clinic-based ABA program and integrating the child. So mainstreaming or getting the child to go to school can be part of an ABA program for sure. But if your child is prompted 100% of the time while they're in school, then that's not a good thing. Like, the purpose of having an ABA therapist in school is for the ABA therapist to use that year to fade themselves out. Yeah. But if you're going to have an ABA therapist prompting the child to do every single thing, then no, I'd rather be at home actually working on learning that thing, because I don't want my child just to learn to model someone else. Yeah. I want my child to actually have support behind them, but learn to do the things that are in the classroom.
Yeah, I
Hopefully.
think one of the problems is that school does not understand the whole fade process. They believe that the minute somebody doesn't have to be prompted immediately, it's time for the aid to go.
Yeah.
So that's a little bit dicey. I can
It depends, yeah.
I can tell you that we worked really hard with making a good relationship with the teacher and the aide,
And that's very important.
so that if the aide could be there and be helping our child, but in the fading process also be helping to do other things, so that the teacher could be talking to the child.
Right.
And if you get the teacher on your side, it goes much better.
Right,
That's
right.
really important.
Definitely true.
TS says, hi, struggling to potty train my 6-year-old. He was fully trained at 4 years old, but had one wee accident and after that regressed. Since the last 2 years we are in scheduling, he likes the feeling of being wet, which means any accident leads to more accident.
Yeah, that's kind of a tough one. I don't know if you've gone back to full retraining, and I would like start from scratch. And also, I think if you can, when you do the full retraining, remove his underwear completely. In other words, we learned that when children are naked, they don't get that feeling of wet. So some children do actually like feeling wet, but if they're completely naked, they will not have an accident. So you might want to start back there again and gradually move forward. It's a little bit of a tough one here. And depending on your child's level of understanding, you could also set up like a token system in economy where, like, if you are dry for X period of time, then you can go and splash around in the bathtub.
Right.
Whatever another form of being wet, use that as a reinforcer. But when you're doing the actual potty training itself, if you don't have a underwear or a diaper or something on, that feeling of being wet is no longer present.
And a lot of us, if you're squeamy about them being naked, a lot of us just got long t-shirts that were 2 sizes too big for them.
Yeah.
So it's not really touching them, but modesty, if that's a thing for you, that's what a lot of us did. Okay, Lucy says, how does the interverbal operant help with pragmatic communication? And can there be goals created for this in ABA and in school speech? Also, how to do this at home?
Wow.
Yeah.
So I love that so many of our parents are talking about interverbals, which is awesome.
They were like, that's where I want to go. I love that.
No, and you should. That's awesome. They are two different things. They overlap, pragmatic communication and interverbals. They do overlap a little bit, but they're completely different things. And if you want to look at, in fact, some of the pragmatic stuff that we teach our kids starts out relatively rote. And then again, it goes all the way to levels of generalization. This is where I have to, tell you about skills. And if you go to skillsforautism.com, we have a curriculum or a program that we wrote many years ago and developed. There's a whole section on pragmatic skills and how to teach them and how to generalize them to daily life. Some of them, as I said, will be done in the format of an interverbal, but like anything else, usually you're going to be teaching them more in the format of, let's say, a tact, and then moving to interverbals, or it'll be interverbals with visual prompting. So not to get too technical here, but I think that separate the two issues. Don't worry about, interverbals are ideal because they're indicating that your child no longer needs a visual or auditory prompt right in front of them, that they're able to process and pull information out of their memory. Pragmatics are more things that have to do with how, the shape of language, the look of language. So don't confuse the two. Just go to, even Google, some pragmatic lessons in pragmatic communication, and you'll see that a whole ton of ideas will come up of things that you need to focus on. And if you can focus on teaching those, even if they're initially very prompted, that doesn't matter because eventually they'll become useful, and once the child starts to use them, they'll be classified as interverbals.
Yes.
It's hard to differentiate those two.
Well, it is, but I will tell you too that the other thing with interverbals, like everything else, if it were a college class, there would be a lot of prerequisites.
Yeah,
right?
yeah, for
Like,
sure.
You know, I always thought of it as if, like, you open a brand new computer and there's no files.
Yeah.
Right? So you can't pull from files for pictures and
That's
things.
right.
Right? And before, in order to do interverbals, if your brain was the computer, you have to pull from files.
Yes.
And so you have to set up the files first. So there's a lot of prerequisites, and they're all on skills if you want to get
Definitely.
to interverbals.
I mean, skills is a monster. So once you're in there, hopefully you'll find a lot of things that are useful.
Like they'll teach you how to teach general knowledge things, like things that you just need to know to have conversation.
Yeah.
They'll teach you functions of things and features of things and classifications of things. They're fun lessons. It sounds dull. It's really fun when you're teaching that kind of stuff. And watching your kiddo put it together, good stuff.
Yeah.
Dika says, what about sensory overload when you bombard an autistic child with information?
So I'm so glad we got to see that
Yeah.
question, because sensory overload can happen if you are not even presenting a single item to the child. Sensory overload doesn't have to do with the amount of information being given to the child necessarily. It has to do with the senses of the child and what's in the child's environment. I'll give you an example. I could have a child come in here and just sit where Shannon and I are sitting, and they might have sensory overload simply because we have 10 very bright lights shining on us right now. So they could have sensory overload if they have visual sensory dysregulation. Another child could come in and sit down and have sensory overload in, let's say, someone's bedroom where they have a sound machine on for sleeping. That could cause sensory overload. Sensory overload has to do with how our senses receive information from the environment. And if your child is experiencing sensory overload, that means that you need to be very aware of their sensitivity in that particular sensory arena. If your child is very sensory sensitive to sounds, let's say, then I would list all the different environments that my child might be reacting to sound. In these environments, it's so severe that I'm going to give him noise-canceling headphones. In these other environments, it's less severe, and maybe I can acclimate my child and teach him to tolerate it. In these environments, it's a fear thing, and I have to teach my child it's okay if there's lots of people in a party. I know initially that's a scary thing, but we will practice together and you'll see that it's okay. So it's, you know, sensory overload is a different thing. The information that you're giving a child can also bombard the child, but remember, this is where that word fair comes in. When you teach a child, when you give them new stuff, it has to be at their pace and rewarded constantly. The experience of learning has to be fun and fair. And that really has to do with the quality of the person teaching.
Absolutely. And the quality of their ability to listen and notice.
And pay attention to the child's response, correct?
Yes, because if you're trying to teach a child who is bordering on sensory overload, it's not going to end well.
That's right, that's right.
Well.
And also remember, when you teach a child something, as soon as it becomes useful, it becomes kind of natural to the child, because they realize, oh, this is pretty useful. I can use this to get the things I want. I can use this to whatever it is. And then it's less likely that they will feel like they're being bombarded with information, because now they're on to the next thing.
Exactly. TS had a follow-up about the potty training. They said, I've also noticed that if I put the pull-ups on with scheduling, that helps, but does that mean he will be in pull-ups always?
No,
and
it
they said,
doesn't.
unfortunately, he's minimally verbal and lacking a lot in receptive language.
Yeah. Then I would go back to the pull-ups and I would stay there for a little while, maybe a few weeks, because with potty training, you don't want it to become a battle, right? So just let it be, right? Go to the pull-ups, let's stay there for a little bit.
Be successful.
Be successful, let him be successful, and then you can always go back to underwear a little bit later.
Yeah, Absolutely. All right. Sending you a hug. That's really all the time that we have left for today. But my gosh, it was so much fun to be talking with so many of you and answering so many questions. It's just such a privilege.
Yeah.
On tomorrow's show, because we were asked, we haven't done any, sometimes I do these things called parent-to-parent talks.
Yes.
And I was asked to do a refresher on the basics of ABA. So tomorrow I'm doing
lovely.
a parent-to-parent, the basics of ABA, talking about some of the things it is and some of the things that aren't, without all the jargon.
That's awesome.
Parent to parent. So that'll be tomorrow for any of you that are interested. So that's happening tomorrow, and we're trying to get ready for April. We're trying to do a lot of pre-interviews and stuff.
Oh my gosh, yeah.
Trying to stay healthy so that I can keep doing that.
Yes.
But anyway, thank you guys so much for being here and being a part of this. I know I had said I'm going to be at our Monrovia office this evening.
Oh, nice.
There was somebody who was watching who wanted to know when that was happening. That's tonight that I will be at our Monrovia office.
Very
and we're
nice.
Thrilled to have the opportunity
fun
to
for
be
them.
there. And so excited. We're saying thank you to Wild Republic. I always get it wrong. Wild Republic, who donated a bunch of beautiful stuffed animals to us, that we donated a bunch of them to the Ed Asner Family Center, that they gave them away, I believe, and we've been taking them and having these wonderful events where we
Awesome.
go and they get to pick which stuffed
Amazing.
animal they want. Thank you to Wild Republic for that. So we'll be back, but it sounds like we don't have you next week.
I'll do the show. I just won't. I'll be in Florida.
Distance.
Yes.
Okay.
Yes.
All right. So we will be back next week with Ask Dr. Doreen. So I also want to remind everybody that if you are in town this weekend on Sunday, there is that concert that is to benefit Autism Care Today. And we had Katrina Aguilar
Right.
on the show yesterday. And there will be 2 other performers on the spectrum. And the proceeds for that go to Autism Care Today. That's Sunday. You can find it on Eventbrite. It's in Hollywood at the Hollywood Women's Club.
Amazing.
This amazing venue. I will be there. I hope to see you guys there. If you aren't able to go but want to buy it, the tickets are $35 and $25 depending on where you want to sit. If you want to scholarship a family locally
That would
because
be
you
so
can't
nice.
be here, buy a ticket. It goes to Autism Care Today, and we'll make sure that somebody locally gets the ticket. So that's on Sunday. All right. Now I've gone over. Thank you so much. Thank all of you.
Thank you.
We'll be back tomorrow. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
Bye, everyone.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.